Are you ready? Is it this October? Is that right? This October, ObamaCare comes to Colorado. To find out what you need to know from our Healthcare Policy Center, Linda Gorman, welcome.
Thank you.
All right. I'm just confused. I mean, I don't know exactly what goes on. So starting in October, the law goes into effect, correct?
Well, it's already in effect, but starting in October, the Colorado Exchange goes live, so you're supposed to be able to start buying health insurance through this exchange. And by January 1st, you either have to have health insurance in place, be in an exempt category, or pay a tax, a penalty.
It's a penalty.
Justice Roberts says.
It's a tax. It is a tax.
It's not actually a mandate. You have a choice.
You have a choice to either be taxed or get in line. All right, so when you say go to an exchange, help me understand. Exchange is
It's just an insurance brokerage that's run by a private group in Colorado. And in Colorado, it's called Connect for Colorado. And it can distribute federal subsidies for health insurance if your income meets certain levels.
All right, so this is one of those nebulous pseudo-governmental organizations,
yes.
Right? This is not the government, but it's funded by the government. So kind of like, Pinnacle, the company that does workplace insurance. This is kind of like that, right?
Right, only more so because this exchange doesn't get any money for the subsidies unless it does exactly what the federal government says. So basically, you take a big federal government shell, you put it in Colorado, you give, they've burned through over $100 million of taxpayer money setting this thing up, and then
$100 million just to set up the shell.
Yes, and it has to be self-supporting ongoing, so we're all going to pay.
All right. So in other words, insurance rates are going to go up.
Yeah. Oh yes.
What do you mean? Oh yes. I heard they weren't going to do that.
Well, do you always believe everything your federal government tells you?
Yes.
Okay.
At least half.
That explains it.
So starting in October, people in Colorado can go to Connect to Colorado. Connect
for Health Colorado.
Right,
I should know the name. Connect for Health Colorado, yes.
Connect for Health Colorado. And they can say, I don't have insurance, or I want better insurance, and these guys will find you a policy with different companies. Is that basically how it works?
Only within their restricted set of companies. Companies can decide to offer policies in Connect for Health Colorado or not, which we're going to call the exchange for the rest of the program. And some companies have decided to sell policies in it, and some companies haven't. And the policies that are sold in the exchange aren't necessarily the same as the policies that are sold outside the exchange. They have different networks. For example, a lot of the exchange policies don't have networks outside of the state, or some, outside of the Front Range. And some you can't get if you're not in the right county, and so forth. So it's fairly limited, but in exchange for dealing with this limited set of policies, you get big government subsidies. And the way the subsidies work is they check your income, and then they say, okay, your income is this much, so you're worth this kind of subsidy. So the government then sends the subsidy directly to the insurer, and you have to pay so much a month for your policy.
If you don't want a policy, if you're one of those guys who said, no, it's not their business, the government's not going to force me, I'm going to pay the tax, the penalty. It can't be mandated, but they can charge you if you don't comply. What's it going to cost?
First year, it's basically going to cost about 1% of your income. The reason is that you don't have to file if you have income about under $9,700, and the tax/penalty only applies to people who have to file federal income tax. So if your income is too low for federal income tax, then you wouldn't have to pay the penalty. And you can still get health insurance through the exchange. So the first year,
I'm so confused. So if you don't have money to buy insurance, the exchange is there to subsidize you to buy insurance, but if still you don't want to pay the little bit of amount that you would have to, as a copay basically, to get the government insurance, you can say, I don't want it. You don't have to pay the penalty,
unless they catch
tax.
You. Unless they catch you, yes.
Unless they catch you, but even if they don't catch you and you're under a certain amount, but you still get coverage.
No.
No.
No. Well, you'll get the usual safety net coverage that you have now. I mean, nothing has changed about people being able to go under EMTALA to the emergency room or to the federally qualified health centers. If you don't have any income and you go to the exchange, if your income is under a certain level, you must enroll in Medicaid. So if you now, have let's say an employer policy, that goes away. You've liked your employer policy. and your income doesn't meet a certain level, you're in Colorado Medicaid. You don't have any choice about that. And if you're eligible for Medicaid, they will not let you buy an exchange policy. You can't say, well, wait, I'll work a few more, I'll send my kid out to work and take the money. No, that doesn't work.
All right. So first year, what happens after a couple of years? What does the penalty go to?
The penalty, maximum penalty ultimately will be 2.5% of your income, capped at the national average bronze premium. But nobody knows what the bronze premium is going to be. California's published it right now. It's estimating about $3,000 a year for its bronze premium. So really nobody knows what the maximum penalty will be.
So we'll find out
but
years from now.
We'll find, we had to pass the bill to find out what's in it. If your income's over about, single person about $46,000, you're not going to be eligible for any of this. And so you're welcome to go to the exchange and buy one of their full price policies, but I don't see why you would. So you just go to an insurance broker as normal and get yourself a policy.
So if you're making $46,000 a year, you must have proof of insurance, or
with your tax return.
With your tax return, or you'll be paying the penalty. So now if I'm understanding it right, help me out. The IRS now becomes the enforcement agency to make sure you have insurance or penalize you.
Yes, and the law, in order to get it passed, has vastly restricted the IRS's ability to collect the penalty. So it can't come and put a tax lien on you like it can usually. The usual tax lien where it takes your stuff away, or it grabs your bank accounts, or shuts down your business. The only way it can work is to withhold your tax refund. So this is when you don't want to give the government a loan. If you've decided that you're going to incur the penalty, don't give the government a loan. It won't necessarily.
You say don't give them a loan. Make sure that
don't
you claim
overpay your taxes.
Claim enough expenses on your W-2 so that there's not a whole lot of withholding, and then they can't take it from you.
Right, and you can always go to your employer, of course, with a W-2 and say, I've already paid my tax liability. Don't withhold for the next couple of months, kind of thing.
Yeah.
I mean, you're going to have to watch that much more closely than you did before if you decide to do that. Now, we're not advocating that people get into trouble with the IRS, but Chris Conover has a great article out. You can see it just by Googling his name, and it's on National Review Online, and I don't recommend that you commit fraud, but since the administration has said it's not going to be checking any income declarations for these exchanges, I mean, this is egregious. This is just asking for fraud. He gives 4 or 5 ways that it's easy to commit fraud now in the exchanges. Get this subsidy, even though your income isn't there, because all you have to do is say, my income is this.
The idea is that everyone must have insurance.
No. If you're an illegal alien in this country, you aren't covered by this law, and you're not eligible for any of these subsidies. It's only for legal U.S. citizens or residents.
All right. If you're a legal citizen or resident, you must have insurance.
Unless you're Amish,
or you have another reason why you can't do it, and it hasn't been adjudicated.
Yes, in general.
If you're Catholic and you don't want to be part of this insurance plan that covers abortions or birth control, you still have to pay for it, even if it's against your religious belief.
And that's why Hobby Lobby and Hercules Industries have sued, because it's forcing them to cover things that you've never had to cover before.
The guys who passed this law covers them too.
Well, it did, yes. It does. The law does. And then President Obama simply had the Congress freaking out because all of a sudden the staffers would have to get their insurance via the exchange. And if you get the insurance via the exchange and you make too much money, you have to pay the premiums. And they'd never had to pay premiums before because they'd had this great employer plan. But the law says, no, you don't get the congressional employer plan anymore. You got to buy exchange policies along with the rest of us. And people who wrote this are going, no, we don't want to be in here. So in what's probably an illegal maneuver, we're no strangers to that at this point, the Obama administration said, no, it's okay. Yeah, you have to buy these exchange policies, but the Office of Personnel Management is going to pay your premium anyway, which there's no provision in the law for this. The same as when it said to the employers, wait, we're not going to prosecute you for not reporting. There's a whole bunch of employer reporting, because how else can they tell whether your employer offers you coverage or not? See, under this law, if your employer offers you affordable coverage, and there's a definition for that, then you're not eligible for any of the exchange subsidies. So the bureaucratic thinking was, okay, the employers are going to report, The person comes to the exchange. The exchange checks what the employer's reported. The exchange checks the tax record. And then if you've got affordable coverage, you have to buy the employer plan. You don't get any subsidies. And it's so badly done that the administration just said, oh, employers, don't worry about reporting. We're not going to check.
How does everybody know everything? There's going to be a database, and I'm curious about this database that Colorado is going to have to use just to keep all this stuff straight. What is it? When does it take place?
Oh, well, the whole idea here was that all of these subsidies are based on income, which is a really bad idea because when you think about it, nobody knows what their income is day to day. There is no real-time income. We file our tax returns 4 months after the end of the year so we can figure out what our incomes were. Now, if you have a salary, you pretty much know what your income is. But a lot of people don't. They work part-time.
They have
members
small
of the
businesses,
households.
there's S corporations and LLCs and all sorts of
This law was written
things.
by clueless people who collected academic or bureaucratic checks every month, and that's all they know, right? So the idea was the exchange, to verify your income claim, would check with a federal data hub, which would have all of the W-2 filings from your employer and your past tax returns and so forth. The problem is that it's not, that data hub hasn't actually been tested, and it's looking like it's not really going to be tested until like 2 weeks before it goes live in October. And the idea is that the Colorado Exchange, when you apply, you give it all this information, who you work for, who's in your family, what your income is, all this other stuff. Then their software queries the federal software, and the software handshakes and works flawlessly, and then you get your subsidy or not. And it gets better. The people helping you do this are navigators. They will help you navigate through the sea of information, except there's no background checks on the navigators. They're going to have access to your Social Security number, your tax returns, and everything else. And in Colorado, they don't even have to take the little test that insurance brokers have to take to see if they know anything about insurance. So it's the blind leading the blind in the Navigator program, and the fraud is going to be enormous.
You missed the whole point here, lady.
Sorry.
The idea was for you to explain this to me, and now I'm just more confused than ever.
I can't explain it. They just want all your data, and they want to tell you what to do.
All right.
Like the IRS.
Got only a few seconds left. Tell me, people want to get more information. You put together something that will help. What is it?
We have a consumer's guide to your requirements as an individual under the ObamaCare law.
As an individual?
As an individual, not for businesses.
So we're talking 2
Businesses
pages
are on their
of
own.
guidelines.
2 pages. It's going to be published on CompleteColorado.com on page 2. It has penalty examples. It talks about some of the pitfalls to look out for. And basically, we wish you luck in navigating all this.
Good luck. Here's a life raft. I hope you survive. Yes. Listen for me on KHOW Radio. Thank you, Linda. Thank you. Tell a friend about the Independence Institute. We'll see you next week.